Hi, I'm Dr. Steve Grinstead, developer of the addiction-free pain management system. Today my message is stop calling it drug-seeking behavior. What I mean by that is many people who live with chronic pain and start experiencing medication problems appear to be drug-seeking or med-seeking. When I do trainings all across the United States and Canada, I often have a portion of the workshops where I ask people to identify some of the most common pejorative or negative statements that they hear from other healthcare providers about people with chronic pain. The most common, the most often mentioned is they're drug seeking, they're med seeking. We've got to stop this. What are they really seeking? They're seeking relief. Now for some people, yes, they are addicted. Even people who are addicted, even to alcohol or other drugs, they're not seeking alcohol and other drugs. They're seeking what the alcohol and other drugs does for them. And in many cases, it's providing relief. Now, whether it's psychological, emotional relief, or for people with chronic pain, for physical pain relief. We've got to be clear on this. Unfortunately, over the last 5 to 6 years, the Drug Enforcement Agency, now joined by the Federal Drug Administration, is starting to declare war on pain patients and pain providers. And it is a pretty sad thing. In California, I have a lot of empathy and compassion for my medical colleagues who are trying to treat someone with pain. On one hand, if they don't adequately address their pain, they can be litigated against. On the other hand, if they prescribe something Big Brother, the DEA or the FDA doesn't think they should, now they're at risk of losing their license or even their freedom and going to prison. This isn't right. Yes, there are a small percentage of providers who are running, quote, pill mills, and we already have a lot of laws in place to address that. I believe sometimes, and I hate to use the term, I think there's a witch hunt going on. And we do have a problem, but it's being addressed as a criminal issue rather than a healthcare issue. You know, in 2011, the Institute of Medicine declared chronic pain an epidemic because over 116 million people were living with chronic pain and we were spending over $600 billion on pain management and lost productivity. If that's not an epidemic, I don't know what is. About 1 out of every 4 Americans has or is experiencing chronic pain. It's a big problem, but getting into the name calling, they're drug seekers, they're med seekers, isn't going to help this problem. We've got to look for effective solutions working together collaboratively. Yes, we've got to stop the criminal portion, but that's a very small percentage of the problem. What we need to do is to make sure that patients are adequately treated for their chronic pain. And today it was very frustrating for me because I got a letter from a workers' comp attorney who said that their company is objecting to my treatment because the injury doesn't cover psychological services. Well, this is very frustrating for me because people living with debilitating chronic pain develop psychological problems they would not have if they would never have had that injury. The other thing is I don't only provide psychological services for things like depression, sleep, anxiety. I provide cognitive behavioral pain management interventions, especially helping people deal with the psychological, emotional components of the pain. So please, my message today is very simple. Stop calling it drug seeking. Thank you.